Hey, all you Arizona lovers. This is the Finding Arizona podcast. I'm your host, Jose.
And I'm your producer, Brittany.
And here at Finding Arizona Podcast, we collect the local stories of all entrepreneurs and from around the valley. So join us at findingarizonapodcast.com, where you can hear every episode and see it as well at
YouTube. Like, subscribe, and comment below who you want to see next on our show. And when you're ready to start your podcast, you found the right spot. Found House, your next podcast production company.
Now, let's get back to the show. Score big with SeatGeek. Whether it's concerts, sports, or live events, SeatGeek has you covered. Use code FindingArizona to get a fantastic $20 discount on your SeatGeek tickets. Catch your favorite live events hassle-free with extra savings. Visit SeatGeek.com and make every experience unforgettable. Welcome back, everybody, to the Finding Arizona podcast. I'm your host, Jose, and as always, we bring in very special guests every week, and today is no different. As you can see, we're not in our normal studio, but today we are sitting down with Dr. Saran here, and we are at Bright Endocrinology, and I just want to say thank you to Dr. Saran for joining us here today.
Yeah, thank you for coming all the way out here.
I appreciate that. So I'll give you a little bit of insight. We ask everyone this very singular question. A lot of the times it's just to get to know you a little bit better. But for me, I like to ask this question because it gets to the root of a tree story. Mm-hmm. And so give us a little bit of how you got started. I can't imagine as a youngster you thought to yourself, I want to be an endocrinologist.
No, that was a tricky one to say, even for adults.
Yes.
Yes. I actually have an Instagram post about how do you say endocrinologist. Yes. I would say it was not a straight line to get here. I am not, I'll disclose this about Arizona. I'm not a native Arizonan.
Perfectly fine.
But I came out here to go to college, and this just became my adult home.
Yes.
You know? So now I've been here longer than I was there.
Okay.
But growing up, I grew up in Portland.
Nice.
I didn't exactly know what I wanted to do.
Okay.
I was a smart kid.
Yeah.
You know, I was in the honors programs and I got good grades. And I felt a little lost when, you know, we're applying for college and people knew what they wanted to do. And I wasn't sure, but my background, I did competitive ballet and other types of dance growing up. So always kind of a health focus, you know, fitness, nutrition, things like that.
Okay.
It was actually one of my mom's friends. She was like, you should become a dietitian, you know, a nutritionist. Yeah. And I was like, oh, that's actually something that interests me that I'd be passionate about.
Yeah.
So it's not the most common major. So like the state school, if I would have stayed in state, they didn't have it. So I ended up coming out to Arizona because ASU actually has one of the top nutrition programs.
Okay.
So that's what I thought. I thought I was going to be a dietitian.
Huh. That's so interesting. So I'm just going to go back to the very beginning in Portland. Is any of your family members or anyone in your family like anywhere near the health industry?
Not my immediate family. Okay. My grandfather, who's in California, he was like a general practitioner through the military.
Okay.
And I'm honestly not sure if he was just a GP or he did a residency as a family doctor. That's technically a specialty. And so my dad actually hated it. So, because he did everything, and that was back in the day when, I mean, there wasn't as much medical knowledge. You could do all these things. Now things are so specialized, but his dad was, during surgeries, he was getting called to the hospital to go deliver babies. He just did everything.
That's so
and
amazing.
My husband was like, Christmas, we had to wait till dad came home from the hospital or he'd get, called away. So he was kind of anti-medicine, just because of the effect it kind of had on family life.
What was your relationship to your grandfather?
We were not close.
Okay.
We would go out and visit probably, once a year or so. Okay. But I wouldn't say I knew him that well.
Okay.
Yeah.
I'm just kind of curious, just all in all, because the sense of like, the idea of like your father not being all for the medical just because what it takes away. Yeah. And then on top of that, his like relationship, like I just wanted, I'm curious because of the fact of like some people walk into their degree or their major, or their passion with previous knowledge or previous background, so to speak. But some people just walk into it like like myself, like you, I went to school with an intention towards a certain path, and that was architecture. And then I actually didn't know about what I do today, which is landscape architect. And I didn't know about that until I actually got to college. So my thing was like, I just fell into it and fell in love with it. But it's like everyone's different. Everyone has a different like way of going about
and like
it.
if you look at like my upbringing and my husband's upbringing, like I grew up fairly middle class. Like I didn't have a lot of friends whose parents were doctors or lawyers, and my husband did. His dad's a dentist. So I think there was a little bit of just, you know, this is normal to do. Whereas to me, a doctor was like, ooh, like that's,
up
you know,
there.
right. Kind of put someone on a pedestal. So it was never really something I thought that would be for me. It wasn't really anything I considered. People always joked I have bad handwriting. People always told me I should be a doctor. And I was like, no, I don't want to do that. But then when I was at ASU and I was taking, you know, not just nutrition classes, but all the other prereqs for the major, I had to take anatomy and physiology, and I really fell in love with the physiology aspect. That hit home, kind of my brain. I like things that make sense. There's feedback, you know, there's these signals. And then in response, you know, even with hormones, it goes up and then the signal goes down. It's just all trying to balance. So a lot of what endocrinology is when that balance of those hormones is off and trying to reset that.
Okay, nice. So that now that hits the crux of like the passion part where it's like, the curiosity and seeing the response back of the body. And I can very much empathize because I marvel, my curiosity runs the gamut because when it comes to the biology part, I marvel at everything that we can survive as humans, physically and mentally. Like, I just think that the brain is such a beautiful thing, and that, you know, you could go all different routes and get lost in the different specificities of the body. So that being said, I would love to kind of like, you know, you went to school, and did you end up staying? Did you go back home? Did you?
I finished my degree in nutrition. So to become a doctor, there's no real pre-med major. You can major in anything. A lot of kids will do biology. So I finished my nutrition degree, but I had to pivot in the middle because there were certain med school requirements. So there was a fair amount of science required for nutrition, but they were a little bit different, and there were a few extra things I had to take in order to meet the med school requirements that I didn't need to graduate from college. So my path is a little less traditional, that I was kind of behind, so I didn't go straight through. A lot of people are taking the MCAT, the standardized test, to get in their junior year, whereas I just started taking those classes. You know, as a junior, I had to do summer school. And so it was a big commitment to take on all that. Some of it was financial. My parents were like, we're only paying for it, you know, for 4 years. You do anything extra summer school, that's on you. That's a whole other rabbit hole, but it was actually my mom who wasn't that supportive of me switching and going into medicine. She was very worried that I would be too busy and not be able to have a family.
Wow.
So I think it's her role as a mother. She wanted that for me and didn't think I'd be able to find that balance.
I guess I find the surprise aspect of it coming from, and it's just a different feeling from a male. Like, my mother was really about, for both of her sons, she was really about like education, like go out into the world and learn.
She believed in education, but she wanted me to have a family and not, you know, just be married to my job and things like that.
I get it. And then that part, I mean, I guess it's like, when we got engaged, it was very quickly of like, when's the first grandbaby? And I was like, ease up, we just got engaged.
They weren't pushy like that. It was just kind of the concept, you know. I think she wanted me to have more balance in my life and not just, you know, live for work. And things have definitely changed in the medical field and things like that. But I mean, it definitely was a sacrifice of my 20s, you know, where you're just in school, you're training, you're in the hospital. There are people who had kids during training. I don't know how you manage childcare when you're working, you know, 28-hour shifts. So it did put off, you know, the timing. I'm an older mother. I was advanced maternal age, as some would say.
Well, we had the same kind of, we were a little bit older when we had him. And so it just was, again, we had conversations about how this was going to go about our lives and changing and stuff like that. So it's just one of those things that I was like, oh man, marveling at what she's going through. But on top of that, very much realizing like I've got a lot of changes in my own life with my career and just overall like how we're going to go about it. And she had just changed her career at the time. And so I wanted her to feel supported on top of that, feel like she was getting a good foothold into where she was going to. So I was the one that stayed and really changed my life for the better. I honestly do believe it, because our relationship, me and him, is a lot closer, a lot different than my own with my father.
Sure.
So I marvel at the decision, but I also was like, at the time I was very scared.
Yes.
Yeah. So moving forward from you were graduated and you went through your whole career, what was the aha moment, or what was the pivotal turning points for you to go into your own practice?
Skipping a lot there, but to go into my own practice, I had worked for a different group, so another private practice in the area for about 7 years.
Okay.
So I liked the idea of, having a little more control in the practice. At first you start as an employee, at some point you become a partner where you can have more decision making.
Yeah.
And I didn't really want to be part of a big system. I mean, there's a few different ones in the Valley, and they're great, but there's a lot of red tape.
Yes.
You're kind of limited in what you can do, the flexibility you have with your schedule.
Yeah.
I don't think it's a secret, but these days the cost of overhead has gone up and physician reimbursement has actually gone down. Even Medicare, they've cut, the last couple of years, their reimbursements. Other commercial insurance will kind of follow suit with that. And it's not to be money hungry, but there's just a huge amount of overhead that comes with running a medical practice. And the only solution I was being given was to see more patients. And I was already feeling maxed out.
Okay.
You talk about burnout, it's right now it's really high in physicians.
Yeah.
And so I struggled, for probably 6 months. Do I stay or do I go?
Okay.
I would go to bed being like, I'm going to put in my notice, and I'd wake up and be like, it's not that bad. I'm going to stay in just my comfort zone. This is fine. This is fine. I can do it. And then it wasn't until I realized more about this kind of direct care or concierge model that a lot of primary care physicians were doing, that I saw more of a way out of being just in that rush, see people, turning over every so often, because you're free of those insurance limitations. So for people who really value their health and that, relationship with their doctor, you get better care.
Yes.
So here we don't take commercial insurance. So I know not everyone can afford to pay cash. We do take FSA, HSA cards. People can do that if they have those type of plans.
Yeah.
And if people have out of network coverage, we actually give them a super bill or an invoice they can turn in to get reimbursed or have it go to their deductible. So we just try and make it as much as we can for just your everyday person.
Okay.
But it's really giving people better care and on their terms.
Got it.
So there was no one in the Valley doing direct care concierge endocrinology. Someone asked me, like, how did you learn how to do all this? And I kind of joke, it was strangers on the internet. But there's a Facebook group for direct care endocrinologists.
Wow.
And when I joined it, a year or two ago, I was just kind of lurking on there.
Yeah.
And they'd done a poll. They were probably about 24 adult endocrinologists, about a dozen pediatric endocrinologists in the whole country.
Wow.
So not very many.
Yeah, it's very seldom, very small group.
And there's a shortage of endocrinologists. And so since no one else was doing it, I was either like, this is the best or the worst idea I've ever had.
Yes.
Because it's a risk. And I mean, you can't have the whole market saturated with all of those. But I was like, if I can be the first one, that was what I saw. It wasn't like I set into this, but I knew I wasn't going to survive in an insurance-based world.
You opened up a lot of doors, and I want so much to just follow some things. So the early on beginnings, I want to just ask, what was your conversation with your husband like? Because it's I'll admit, every time I ask this question, I always love the response of how they like their body, because it shows the dynamic of just relationships in general, because I work with my significant other, but again, everyone has, if you're not single, you have someone that you kind of like rely on as far as ideas and just like, thought process. So please break this down for me.
So, I mean, more or less, he was supportive.
Okay, great.
Sometimes I just wanted him to tell me what to do. Because like I said, we would have those conversations all the time. And I had such a hard time. It was a big leap.
Yeah.
And he would not tell me what to do, which, I mean, now I appreciate, but he really wanted to be my decision.
Yeah.
Obviously, there was a big financial impact for our family to, quit my job, time to get this, started, the investment it takes to start something. So luckily, we were in a financial point where we could do that. We just had to cut back on a few things.
Understood.
But he's been very, emotionally supportive of doing this. So, someone on my CPA asked me, it's like, how did his name end into this? And I'm like, I have no idea. They're like, is he helping you with this? Like, no, he's not helping me at all. He knows nothing about my business other than, when I tell him when it's, the kids go to bed and I'm like, how do I work through this?
Yeah.
So no, he's been great. He listened to me for a solid 6 months, just to be like, yes, no, yes, no.
Yeah.
So, he's been really supportive.
Yeah, that's really great because again, I go back to like, she's the yin to my yang. So before I said to her, like, I want to go on a date, I was like, I'm very busy on the weekend. There's this thing I'm doing. And she's like, well, what is it? And I said, it's a podcast. And she goes like, oh my God, I love podcasts and tell me all about it.
Really?
Yeah. She was
even
really
10 years ago. I don't think I knew that much about podcasts.
And so we were very like, that's how we grew together as a couple. It was like, I would tell her, hey, help me out with this photographs or help me out with this business thing. Yeah. And so she had a business at the time and we just figured it out together and it grew into our relationship and it kind of snowballed into what we are today. And it's really, I say this podcast has done a lot for me and it really has changed my life a lot. So the other thing I wanted to bring up, and this has come up a lot more when we're talking the medical field, is the red tape and just kind of the shackles of how we're, to the actual system itself. And this is why a lot more people like you are trying to combat that or at least seek refuge in like the private practice on their own. But what I'd like to ask is more about like, have you seen that more and more happening especially as the economy changes and a lot of things go into play? Have you seen that happen more and more? And what do you tell your friends and colleagues?
I mean, I think insurance companies are really running things now.
Okay.
I think as physicians, it used to be independent places. And then as medicine gets more specialized, there's more to do. There becomes just more tape with some of these systems. Yeah. We kind of said, just let me practice medicine. Let's hand over the business to kind of something else. Okay. But then you start to get kind of these big corporations, or even little independent places are, struggling and someone comes along and says, oh, we'd like to buy you. Yeah. Here's X amount of money. You work for us for the next couple of years. And then, you can go on your merry way or stay if you're happy. And so I think on an individual level, that's helped some people who are struggling. But I think the system as a whole is suffering from that.
Yeah.
There's now even insurance companies who own physician groups.
I have heard of these.
Owning hospitals. Yeah. There's laws that say that physicians can't own hospitals. They've actually done studies looking back and they saw that there were better outcomes in physician-owned hospitals than, insurance-based or major corporation. So there's definitely a change, but there's a lot of rules. Kind of our hands are tied with some of these things. And even the last practice I was at, it was a decent size endocrinology practice. There were over a dozen providers there. Even trying to negotiate, okay, our rates haven't changed in 10 years, what we're being paid, obviously overhead has gone up. It was a struggle. There was a lot of, you had to pay someone else to assist you for that. It just keeps raising, the price of overhead, having billers fight because all they do is deny claims or they don't want to pay you. Sometimes they'll even pay you and then 6 months later take it back and say, oh, you didn't submit this right.
Yeah.
It's
a struggle that I see every day, or at least experience, from the sense of like the private practitioners come to us and kind of divulge a little bit about their practices. But what I always try and bring out is like, I'm so glad that there's an individual who cares enough more about the patient than having to deal with the red tape, because that means a lot more to me as the patient. It's like, you care.
One of the main things there when we look at kind of all this red tape and trying to get out of that system is just getting back to having that relationship with the patient.
Yeah.
Getting to know people. It's hard I manage a lot of diabetes. It's hard to manage that well when, you have a 15-minute appointment and only 5 minutes of that is in front of the patient.
Yeah.
So you've got to review the chart, review the labs. Yeah. You've got to document everything. Yeah. You've got to submit orders, refill prescriptions, do the billing, and you have 15 minutes to do all of that.
Yes.
So now I don't have to spend as much time documenting because I'm not trying to. It's more for me to help, what I need to know or pass on to like a referring provider.
Yeah.
But it's not just meeting all these arbitrary codes that I have to get reimbursed by insurance.
Yeah.
And the visits are now twice as long as what they used to be.
Yeah.
So, we have 2 different levels of membership depending on what someone needs. So if someone needs more of that and they sign up for our elite program, then their visits are, unlimited. They get my personal line. If they need anything in between, then we're there to, fully support them, when they need it.
That's awesome. So you did bring this up as we kind of like now go into our conversation that goes into the actual weeds of the grass of like services, packages, things that people are expecting when they come to you. I know that you brought up like the twice as long, interview process, but just give us a little bit more sense of like what the concierge part of this will look like for the client.
Yeah, that's a good question. So it's a little bit different even if some people are used to that from their primary care doctor. As a specialist, it's a little bit different.
Okay.
So most of the concierge or direct care primary care physicians just charge an annual fee. You always need a primary care doctor. Yeah. It's a little bit different. I mean, if you have diabetes or an underactive thyroid, that's kind of the bread and butter of endocrinology, those conditions probably aren't going to go away. I do see people make major changes in their lifestyle and type 2 diabetes can go into remission. And my goal is always to get people better. Yeah. So we do have that annual membership for people, but I tell people after the first year that you may not need it. You know, my plan is to get you better, and if you only need to see me once or twice a year, then after that first year, we'll let people kind of pay a la carte, kind of fee for service. Yeah. So things that are included in our membership is like some of that in-between communication. If you're not a member, then we do bill kind of like a lawyer would, it's just based on time. Yeah. You say, hey, my other doctor ordered these labs. Can you take a look at it? Mm-hmm. Sure, I'm here to help you. Yeah. But if you're not a member, then we'll just bill you based on how much time it takes. But I'm happy to do that. Okay. We don't usually say no to anyone, but I encourage, pretty much everyone in their first year to sign up as a member, depending on the package that you want. So the elite is really kind of the all-in, people who are really engaged in their healthcare, want to make sure they can get everything done in kind of a timely manner. Okay. And sometimes it's just not in someone's budget. So our lower level, our premium is a little bit more cost effective. People are just limited to 1 visit per month. Okay. And they don't get that in-between communication included. Got it. So your other doctor's orders labs, it's just got to wait till next month. Got it. And most people don't need 1 visit a month. I'd say most people probably see me once a quarter. But then if that does come up, my primary care ordered this, can you take a look at it? Yeah. We just count that as their visit. You're not going to get a bill from us if we haven't seen you that much. Or my acupuncturist recommended these supplements. What do you think? Then, we can just have a quick conversation. Perfect. And it's nice that people aren't having to take off work, come into the office, to do all this. This is stuff we can do. I can either just pick up the phone and call you. Mm-hmm. We have an app where we can more or less text people, but it's encrypted, for HIPAA compliance. Great. And so people love that they're not having to, drop what they're doing. We do a lot of weight loss here. And so sometimes, at the end of the month, it's like, do we keep you on the same dose? Do we go up on the weight loss medication? And so people are just checking in with me like, hey, I've lost 5 pounds. I'm happy. Can you just send in a refill? And It's like, cool, I just need to know how you're doing. Like if we hit a plateau,
let's talk.
Right.
Yeah.
But you don't have to take a half a day off work, and come in to tell me that. Because an insurance company, you're not getting paid for that in between, communication.
Absolutely. So I have to be totally honest with you. Between my wife and I, we're very much in like getting to the very start of our, I would say, biohacking journey. And we've started to really get into, just again, what our family history is and what we can do ourselves to help prevent certain things.
Right.
I know from my own sake, heart health is something that's on my father's side that I want to be concerned about. But I actually was born, on my mother's side, she's Native American, and so diabetes is a very high risk, and on that side. So I've always kind of maintained a healthy sense about what I eat, how I go about my health, and what I try and do actively to help prevent anything from happening for my own health and for my family, and just kind of prolonging that. So the things that we get amped about is the technology side. And I can help but see that you have an Oura Ring on,
yes.
And just wanted to know personally for you, the types of things that you're trying to do to keep, in tune with your own body, some technologies that, help excite you about what people can do and wearables are very, very trendy and very much in the limelight right now. So give us a little bit of insight into your world about like what excites you or what you use.
So I love the Oura Ring. I use it mostly for sleep.
That's perfectly fine. I get that. And that's
I
what
love
she uses it for.
tracking my sleep. You can kind of tag things to figure out what it is, the heart rate variability. The Oura app will be like, oh, your heart rate was higher than usual. Like, did you eat something later before you went to bed? And so sometimes your rested score isn't as good. I have my Apple Watch, which I mostly use to track my steps.
Okay.
For some reason, there's a discrepancy between the two. And sometimes I'm trying to figure out why. I mean, the other thing I do just to kind of stay active sometimes when you're just stuck sitting, I have days where I just have back-to-back patients and I'm sitting in the desk, and it's smaller than my old office space where I used to have to be like, get up and like walk, around and go to the bathroom. You're walking back and forth to the different exam rooms. My patients are just in my office. I take 3 steps to open the door and welcome them from the lobby. So my steps have gone down. So one of the things I did was I got a standing desk.
Nice.
And I got a walking pad.
Okay.
So the walking pad just sits under my exam table.
Nice.
It just scoots under there. People don't even know it's there. And then sometimes if I have back-to-back patients that are virtual or doing virtual visits, I'll walk while I'm talking to them.
Oh, nice.
No one says they can hear it. So I'm just like, if it's distracting, just I'll pause it. I'll just, stand and talk to you. But I'm really trying to, be active when I can. And that's kind of one of my hacks.
Yeah.
Sometimes even on the days where I'm doing admin stuff and I'm not seeing patients, I'll come in here just so I can use the walking desk. Because otherwise I don't like it when I'm just sitting there all day.
Same. I'm very much an avid runner. Like that's my thing is like, I just really like to get out and just go for a nice run.
Yeah.
And that came from high school. Like that's just it just kind of built up
healthy,
over years.
Your heart, your mental health,
exactly.
There's so many positive impacts.
And so for me, when the wearables started to come into the limelight, I just was like, we were testing out. I have my Whoop, but I also have my Apple Watch is charging. So it's like we try everything. And you brought up the like why, and one of the things that kind of we've done research on is the where it's placed on the vascular system.
Oh, really? Okay.
Is how it's monitored. So it's just like certain light too, like the lighting of the backing, so how it tracks and everything like that. So it's just little things of like, it's because that's on your ring that your dominant hand is on. It's like you want to make sure it's like on it's certain
that's what
things.
I found when I do the walking desk is that I don't always get credit for my steps because especially if I'm typing, I'm listening to a patient and I'm kind of typing, my arms aren't swinging.
Yep.
So it'll give me the like, oh, your heart rate was up. Like, what were you doing? But I don't get like the steps. And I'm not going that fast, but it's better than sitting. But since you asked about that, this is kind of a sneak peek.
Okay.
But I am in the process of putting together a longevity package.
Ooh.
Because what I've found is, thyroid, diabetes, that was the bread and butter of endocrinology. Yeah. But here, people, especially the people paying cash, for their healthcare, they're really invested. A lot of people they don't have diabetes and they want to prevent that. So kind of like what you talked about. So putting together a program for people who don't have diabetes, don't have heart disease, and they don't have dementia, they want to prevent that and all the things you can do. And so I'm in the process of doing that. I've done some demo meetings with companies that's looking into the different wearables. Nice. They can kind of incorporate that along with lab work. So you get your labs done. It's in our system. It'll all filter into one app. Nice. And so then you can track interventions that you're doing and see how those go. Perfect. So I haven't decided on a product yet. We're still doing some demos, but that'll be exciting to kind of integrate these wearables and that technology for our patients who, not just want to live longer, but want to live healthier.
That's awesome. Please let us know when you come with a conclusion to that, because I would love to see and do more research into longevity. Is again, one of those words and things that people are starting to realize. I mean, it's starting to be more on Netflix documentaries on like what you eat, longevity, was it the blue zones? Yeah, the blue zones and things like that. So it's just, I think people, as we get better with the technology and our health together, I think the longevity aspect is just kind of a concluding factor of like those two together. It's like we can process it all. We have all the data. Now, how do we, make it so that we can live long, healthy lives?
Right. And at first, when people would say longevity, I was kind of like, what does that mean? Like in your medical training, there's no one teaches you like, this is how you get longevity. You're kind of like, what is that? You live about like, oh, the average lifespan is this, or you get diagnosed with cancer, 90% of people are going to live X amount of years. We kind of think about that. We don't really stamp it with kind of a term longevity. It's a little vague. What is that? What does that mean? And so even when I started to hear about that, read about it, it was kind of an own journey to kind of understand what that means to people. And I think to different people, it may mean something a little bit different. I think it's kind of a rebranding of preventative medicine. And again, when you get into the problems with the healthcare system, a lot of times they don't like to pay for that. So a lot of our Medicare patients, aren't able to seek that type of care unless they're coming through a program like this. But then it's going to be out of their own pocket because Medicare doesn't cover those services.
I just find it also so fascinating too, because some of these guys are going all out. There's one in particular. I don't know if you've ever heard of this guy. He's I think a former tech executive, and he's doing like everything possible to like the longevity aspect. I don't know his name, but it's a very famous guy, and he's spent a lot of money. Just like every aspect of his life is either monitored. He's doing the scans regularly, and he's getting like 8 hours in pitch black, dark asleep.
And some of that I think is a little extreme.
It is very much, and I'm just like, he calls it the longevity thing, and it's just like, I get it, but I also don't get it. I'm just like...
I think most people run into problems when they look at something that's so black and white. I think people can kind of make it what they want. I think a lot of times if people are like scared of the doctor, they're afraid of change or being told that, something's not right, or they have to change something. And so some of this, I just try to make it more approachable, where there's little interventions that you can do. And you mentioned your family history. Sometimes people feel guilty or shame that, that they have type 2 diabetes. And some of these people are fit and active, and it's just like, it just runs in your family. It's not your fault. I feel like it's like a scene from Good Will Hunting where I'm like, it's not your fault. It's not your fault.
Exactly.
But there are things you can do to help, and some of it is being here, and you just need medicine. Some people just need medicine, but people feel like they're not doing enough, and they start to beat themselves up, and that's not productive.
Well, I want to thank you for that, because again, when I was in high school, the very first time that I actually went into the doctor's office at the healthcare clinic, because they're not allowed to call it the doc, it's not a hospital. I was looking at some of the posters around, and one of the ones that like stood out to me was like 50%, almost, no, it was higher, like 60% at the time of all natives were type or some type of diabetes.
Oh, really?
Who, like suffered from diabetes or pre-diabetes.
And a lot of that is genetic. It was survival. You know, people weren't living necessarily that long to develop diabetes. Or, you know, if you're hunting and gathering, you're just a lot more active, you know, as opposed to our Netflix and chill.
But it was one of those things that at the time it scared me. And also, again, that guilt factor of like, I'm healthy, I'm fine. This is a scary thing for me. It's like, so there was that level of it, but it's like, I've learned to grow into the thing of like, I'm doing everything that I can. Put your mask on first before you can help others sort of deal. Because if I worry so much about everyone else, I'm not taking care of myself, and that ultimately does not help others. So thank you again for this conversation. I do like to kind of move and direct our last bit towards goal setting and just like overall things that you're anticipating or really trying to strive for this year or in the upcoming years. I know that you were nominated, or did you receive
I was
in the
Top
magazine.
Doctor.
Yes,
so
Top
Phoenix
Doctor.
Magazine, they have their annual Top Doctor publication. They've been doing that for I don't know how many decades.
Oh my gosh, so many.
But I was in it this year, 2025, and last year was my first year.
Congratulations, first off.
Thank you. That one means so much just because it's voted by our peers.
Yes.
So it's not patient satisfaction scores, people going online and leaving Google reviews or whatever. It really means that the other doctors in the community, you know, trust me. And that's really how I built my reputation up was, you know, I wasn't promoting myself. I was at an already established practice. There were already referral sources when I joined, but it started to be, the referrals started coming in my name because the patients who maybe see someone else had too long of a wait, they would see me, and they go back and they tell their primary care doctor, like, you know, she was amazing. It was different than any other endocrinologist that I've seen. Like, she actually listened. That's, you know, the main feedback that I get. And so then the referral started to come, you know, with my name on it, and people are saying, you know, we want you to see Dr. Saran.
Oh, awesome.
So that one, that feels really good just to know that, you know, my peers put that faith in me.
Absolutely.
And even, you know, a lot of our new patients, we're still growing. We're in our first year. At some point, probably in the next year and a half, we're projected to probably fill up and probably have to cap it and, you know, may have to go on a wait list. You know, the point is that we're approachable. You know, other offices, you're waiting 3 to 6 months to get in, and I don't want that to be for my patients. So at some point there will be a hard limit on that. But for now, we're still seeing new patients. And since I'm the only one doing it, you know, around town, there's someone doing something kind of similar. There's different variations of it.
Of course.
There's one person in Tucson. But maybe trying to expand up north a little bit.
Nice.
So I only have a medical license in the state of Arizona, but maybe trying to reach out to, you know, there was an endocrinologist it was Prescott lost theirs. Trying to expand some services there, maybe doing some telemedicine throughout, you know, the state for people who don't want to travel.
I was going to ask you about that telemedicine because I actually just used it for my own, I had gotten COVID. So I used the teledoc. Was very much something that I found very interesting from the sake of the one-to-one aspect and how we're using technologies to use the video side of it. But also the fact is like, you know, how does the doctor feel on the other end of it about using this thing to kind of, you know, bridge a gap sort of thing?
I think you just have to find the right balance with that. I mean, when COVID happened, we all kind of just scrambled. And so that became the main thing we were using. I actually had like just found out I was pregnant when like the world kind of shut down. So that was scary. So I was kind of the first person in like the practice I was just like, I'm just going to be at home. We don't know enough. This is scary. And so I just forced all my patients to do, you know, telemedicine. There were a few maybe older, less tech savvy people who couldn't figure out the video stuff. And sometimes it just had to be, you know, a phone call. But it's still nice to see people's faces. Sometimes people can't get their video to work. And I'm like, all right, we'll just talk. But it is nice to see their reactions and things like that. So I think technology plays an important role. I think it can help expand services, especially with people who live in, smaller communities, get care. But there is something about just that personal connection.
Yeah.
And a lot of my patients from my former practice lived more east side, even Maricopa. So for them, it's hard.
Yeah.
So I usually say, I want to see you in person, once a year. But a lot of what I manage is chronic conditions. COVID is something I'd probably rather have someone seen in person to listen to their lungs, get an x-ray, things like that. Yeah. And so I just think it just depends kind of how you use it. But then again, you're not giving the doctor COVID because you're not in there, coughing on them.
Okay, so then I want to say this. If our audience who are in the northern part of Arizona can reach out to you about expanding into that market, I hope that they do, because that is something I feel like we get so much attention down here on the southern half. It's just like the north half of Arizona deserves to have that specialization, and someone who cares enough like you just really want to give back to the patient the opportunity to live a healthy life.
Right. Yeah. So I usually like it if people want to reach out. I usually prefer people come to the office so I can meet them in person. Yeah. It's also nice to get a feel, like even when you guys walked in, I think people usually feel kind of this calm, this serenity here.
I think it's the water bridge.
The water bridge helps.
It's really beautiful.
And from my office, you can see it.
Yeah.
And there's a lot of natural light. So people usually feel pretty relaxed when they come in here. It's not your traditional doctor's office. So I think it just kind of helps set the tone.
Yes.
And even if it's a video visit afterwards, they see my diplomas on my wall in the back, they know where I'm sitting.
Yes.
Every once in a while, if I can coordinate all my video visits on one day, I will work from home. Then they're seeing my headboard, my office bedroom. But I really get to know my patients and they get to know me. So sometimes, am I crossing a boundary at somewhere, like people are seeing my bedroom? But I think, we all just kind of, get to know each other. We're one big happy family.
I think after that big chunk of COVID, it's just people
some of it's normalized.
Really, yeah, exactly. So it's like those Zoom calls don't.
It's actually my favorite part. Some of the animals in the background. Yeah. I'm like, wait, no, go back.
Yeah. It's one of those things that's like I learned to love people's styles, because it's like you see what their homes are like. So that's all great. And you brought up bringing people into the office to get the tone. So now is the time for you to promote where they can find you online, social media, if you want to promote that aspect, but address, phone number, where people can find you online. The floor is yours.
All right. So we are located in Scottsdale off of Frank Lloyd Wright, so more the north part of Scottsdale. Probably the best place to get some more information if you're thinking about coming here is our website.
Awesome.
So www.brightendocrinology.com. Bright is BRIGHT. And I got that idea because I wanted something that fit with Arizona and kind of the sun.
Yes.
But I didn't want to pin myself to a specific spot because I wanted to be kind of for all of Arizona.
Yes.
So that's kind of the next phase. Instagram, I'm Dr. Heather Saran.
Okay.
Facebook, I think it has my name and Bright Endocrinology on it. If you search either one of those, I should come up. So.
Awesome. Well, thank you, Dr. Saran, for just giving us a little bit of your time. But first, the fact that someone cares enough like you do to want to step away from the practice of the red tape to now try something different and really give back to those who really want it means a lot. It says a lot about you, and I hope that goes out there into the world and you're able to get some more clients that will be with you for a very long time. Yeah, I'm here to help. Not everyone knows I'm here, so I'm just trying to get the word out so I can help more people. Yes. Before we go, you can hear every episode of our podcast at findingarizonapodcast.com. Social media-wise, Finding Arizona Podcast under everything. And as always, we say kisses, hugs, and belly rubs to our four-legged friends, and we will see you next time.